Hello, folks. For the last few years, we are seeing a steady increase in complex neuropsychiatric presentations in children of all ages, and there has been a new entity under focus which has attracted attention, and that is neuropsychiatric symptoms due to autoimmune mechanisms secondary to trivial infections, especially streptococcal infections in children. They have been named as PANS, PANS, and PANDAS, PANDAS. So let's straight away dissect these conditions and see what they are all about. So my name is Dr. Sayed Kazmi and you're watching my YouTube channel. So let's talk about PANS and PANDAS. So what is PAN and PANDAS? PANS basically stands for Pediatric Autoimmune Neuropsychiatric Syndrome, while PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders secondary to streptococcal infections. So in this presentation, we would look at the definitions. We would also look at the diagnostic criteria for these conditions. We will be talking about some evaluation methods that we employ when we are confronted with these situations, and what are the treatment modalities for PAN and PANDAS. So let's start with the definition. So definition of PANS, which is Pediatric Autoimmune Neuropsychiatric Syndrome. What happens in this? Sudden onset of obsessive compulsive disorder or restrictive eating with additional neuropsychiatric symptoms. So what happens? A child who is not known to mental health services, who has got no prior history of any mental disorder or has never developed any neuropsychiatric syndrome, that child all of a sudden develops an obsessive compulsive disorder. So this child has got obsessions leading to compulsions, certain types of repetitive behaviors all of a sudden, or a sudden onset of severe dietary restriction. All of a sudden, a child stops eating, and that is not associated with body dysmorphism like what happens in anorexia nervosa. This is a normal child who all of a sudden develops obsessive compulsive disorder or stops eating. PANDAS, on the other hand, is a subset of PANS. So basically, this is a special subset of this same umbrella term PANS. But what happens in PANDAS, a child suddenly develops, let's say, new onset tics or obsessive compulsive disorder, but there is a history of preceding streptococcal infection. It's not necessarily that it would be a streptococcal throat infection, but a streptococcal infection anywhere in the body, whether it's a streptococcal throat infection, streptococcal skin infection, or streptococcal perianal infection, whatever. There is an element of streptococcal infection preceding the onset of obsessive compulsive behaviors or new onset tics. So this is the definition. Going a bit more into the diagnostic criteria for these PANS and PANDAS. For PANS, the diagnostic criteria, number one, is that there should be a sudden and abrupt onset. So as I told you earlier, that this child would not be having any past medical history of mental health symptoms, and all of a sudden, this child developed an obsessive compulsive disorder, or that child goes on severe food restriction. Now, with this abrupt onset, excuse me, so with this sudden abrupt onset of OCD or food restriction, there would be a constellation of different concurrent symptoms. And the diagnostic criteria says that of all these symptoms that you're seeing on the screen, at least two should be present along with this abrupt onset of OCD or severely restricted food intake. So what are these concurrent symptoms? A child might be having anxiety, which in most of the cases is separation anxiety, like the child is very much fearful that he might be separated from the parent. The child might have what we call as emotional lability, or might be having an element of frank depression. The child might exhibit irritability, might have like violent behaviors, aggression, or might show severe oppositional behaviors. They might even go into behavioral regression, like all of a sudden losing their speech and going into what we call as a baby speech or babbling. There might be an element of deterioration in academic performance at the school. There might be association of sensory or motor abnormalities, or they might develop somatic symptoms like sleep disturbances or bedwetting. So of all these concurrent symptoms, at least two should be present along with abrupt onset of OCD or severe food intake. And the third thing is that these symptoms are not explained by any other neurological or medical disorder. For example, there's not an underlying element of, let's say, Wilson disease or something else that would be responsible for these types of behavior. In other words, you have excluded the other causes. For pandas, as I told you, pandas is a subset of pans. So the only one thing that differs in pandas as compared to pans is that there is an evidence of a recent streptococcal infection, which can be streptococcal infection of the throat, of the skin, of the perianal, or any organ of the body. So usually you see that there are neurological signs which would be in the form of obsessive compulsive disorder, or there might be what we call as coriform movements or repetitive motor movements which we call as tics. And there is always an evidence of a past streptococcal infection. So group A beta hemolytic streptococcal infection has somewhere occurred in the past. And again, because it's a subset of pons, there would be abrupt onset of symptoms, and usually the age group in which this occurs is somewhere between 3 years and puberty. So in pans and pandas, remember, the onset is always before puberty, though these once this let's say this syndrome starts, it can actually go into the adult life as well, but the onset is always before the age of puberty. Remember, this is very, very important. And as I told you, there is a sudden onset of obsessive compulsive disorder or new onset tics. So pandas is a subset of pans in which there is a past history of streptococcal infections. As simple as that. Now, moving on to the clinical evaluation. When we see a child who till now has been fine and suddenly develops food restriction or suddenly develops obsessive compulsive disorder, it's very important to always start with a detailed history. So ask about like how these symptoms they started, whether how the symptoms have progressed, whether they have taken any treatment for that, where there have been any infection in the past, how has been the psychosocial history, how have been the things at home. And you ask about all these things because there are certain things in which you might see an overlap. For example, autism and ADHD are quite common as compared to this condition. So you have to ensure that there is no element of ADHD or autism. So you have to rule these things out. So because autism and ADHD has got like a very defined criteria, so you would ask questions pertaining to that thing, so to ensure that you are not dealing with a sort of a severe form of autism or ADHD. And you also do their developmental assessment to see where they are on the development scale. Followed by a good history is your physical examination, in which you should do a complete neurological examination to see if there are any components of neurological dysfunction because of any reason which might be responsible for these things. And then you also look for any signs of concurrent infections, like you would look into the throat, you would look into the skin, you would look into the perianal region to see if there has been any element of recent streptococcal infections. So once you have done the clinical evaluation, then you move on to do laboratory investigation. Now, PAN and PANDAS is not a diagnosis of laboratory where there are special type of tests which can be done to, let's say, diagnose these conditions. Basically, it's a diagnosis of exclusion. But you want to do laboratory investigation because you want to rule out the other things and to see if there is a temporal association with streptococcal infections. So for example, you can take a throat culture to see if it grows group A beta hemolytic streptococci, or you might do a rapid antigen test for group A streptococci. You can, if there is no evidence of infection, you want to see if there is something which might be indicative of a recent infection in the past. For example, you can do ASO titers, you can check the anti-DNase B antibodies to see if there has been infection in the recent past. Some of the additional tests that can be done to rule out infection is your full blood count or complete blood count, the ESR and CRP, which are the inflammatory marker, and basic metabolic pallor, which gives you liver profile, UNEs, blah, blah, blah. So we'll do all these things to ensure that there are no other reasons for this presentation. Apart from that, you might have to do some additional assessments depending on the condition, and which neuroimaging is very important because certain structural brain abnormalities can sometimes present with neuropsychiatric symptoms. So an MRI is important to rule out those structural abnormalities, because then in that particular case, the prognosis and the treatment would be altogether different. So for example, Wilson disease, in which the basal ganglia are affected because of abnormal copper deposition. they also present more or less with the same symptomatology and in the same age group. So you have to do MRI to see if there is any evidence of, let's say, basal ganglia being involved because of copper deposition, or you might have to like rule out structural brain problems, like structural brain problems, especially with the basal ganglia and the surrounding structures. You might also have to do an EEG, especially if there is seizure-like activity associated with these symptoms, to rule out a complex seizure in which the same symptoms can also appear. And then you might consider specialist consultations, like you might need to have an input from a neurologist or a psychiatrist or immunologist to get their opinion about these things, to see if they think that it is because of PANS or PANDAS, or it is because of anything else. So remember, neuroimaging, EEG, and specialist consultations can be an important element of your additional assessment that you might want to do if you are dealing with a child who you think has got either PANS or PANDAS. Now moving on to the treatment modality. So once you know that the child probably has got PANS and PANDAS and other structural brain abnormalities have been ruled out, or there's a temporal association with, let's say, streptococcal infections, then you have to treat these children, because otherwise they would be all over the place. They might be causing a lot of problem for themselves and for their families as well. So the treatment modalities, we divide them into 4 categories. Number 1 is the symptomatic treatment. Number 2 is the anti-infective treatment. Number 3 is the immunomodulatory treatment. And number 4 are the adjunctive interventions. So let's take them one by one. So the first one is symptomatic treatment. Now, many of these children have got aggression, or they may have loss of sleep, or they might have oppositional defiant behavior. So in that particular case, you might have to give symptomatic treatment. For example, a child who is not sleeping, you might have to consider antihistaminics like promethazine, 25 milligram at night time, to help them sleep. Or if they are very much depressed, you might have to start with low dose SSRIs, selective serotonin receptor inhibitors, like fluoxetine in a dose of 5 milligram. You might sometimes, if they are very much aggressive and they are like, thrashing things around, you might have to give them a dose of, let's say, olanzapine or haloperidol to cool down the psychosis. With that, they can also have some cognitive behavioral therapy to help them, because these children who have got obsessive compulsive disorder, they have got an insight. They know that whatever they are doing, there is no rationale for that, but there is so much anxiety because they're obsessed with that. They cannot overcome those thoughts, and that leads to compulsion. So there is obsession. Obsession means that you are preoccupied with something. You cannot take that thing out of your mind. And then that leads to an element of anxiety that causes you to have a compulsion. A compulsion means you do something in order to relieve that anxiety. For example, if you are worried about that you've got germs in your hand, you will repeatedly wash your hands. So these kids, they require some cognitive behavioral therapy so that they can understand that there is no basis for their fear, and how they can overcome those fears, which can sometimes help in these types of behaviors. So symptomatic treatment depends on whatever is the symptomatology. Then moving on to anti-infective therapy, especially if there is a temporal association with streptococcal infections. So you have to treat the infections if it's not being properly treated. So there are many types of antibiotics which can be used to sort of eradicate streptococcal infections. That includes your phenoxymethylpenicillin, amoxicillin, cefalexin, or other antibiotics. The doses have been given. You can follow the doses that have been given on the screen, or you can follow the your own, let's say, hospital guidelines, whatever textbooks you follow, or you can follow the NICE guidelines for these medications, or you can follow the BNF. So again, it depends, but different types of antibiotics can be given to eradicate if there is an infection, or if you think there has been an infection which might not be properly treated. So the third category is then the immunomodulator therapy. Now, immunomodulator therapy, again, there are different schools of thought. Some people say it should be started early when you are dealing with PAN or PANDAS. Some say no, if you have to classify the symptomatology into mild, moderate, and severe, and you only have to consider immunomodulator when you are dealing with severe forms of PANS and PANDAS. So immunomodulator therapy, because this is an autoimmune condition, so you have to do some immunomodulation. So the types of medications which are used for immunomodulation are your anti-inflammatories like ibuprofen and steroids. So steroids can be given in a dose of 1 to 2 milligram, or high dose pulse therapy, for example 60 milligram per day for 5 days and then tapering off. Or you can give like up to 2 milligram per day for a few days. Or the in ibuprofen, the immunomodulator dose is around 10 milligram per kg. So you have to give anti-inflammatories and you have to give steroids. With that, you can give some antipsychotic medication to calm down the abnormal behaviors. There are different types of atypical antipsychotics which are used for that, risperidone or aripiprazole. I personally prefer risperidone in a dose of 0.25 milligrams. So you start with a low dose of risperidone to 0.25 milligram, and then you can gradually increase every 2 weeks till you reach a maximum of 1 milligram. And that you can actually stop at, or like sort of continue on that particular dosage. So immunomodulator therapy can also be considered, though in most of the cases this is the domain of the specialist, like the immunologist or the neurologist or the psychiatrist, who probably would decide to start them on these therapies. So these are some of the therapies that can help these children with PANS and PANDAS to live a normal life. So this was all about PANS and PANDAS, which is a new entity gaining interest of the doctors and of the public as well. And in the last few years, as we are seeing more and more neuropsychiatric presentations, a few of them are turning up to be because of PANS and PANDAS. So don't get surprised if you see a child who suddenly develops acute onset neuropsychiatric symptoms like OCD or tics, and he has been fine. You might be dealing with PANS and PANDAS. So think about these terms, and you can do the relevant workup, or try to fulfill if they have got the diagnostic, if they fulfill the diagnostic criteria, and you can take it from there to help out these children. So thank you very much for listening to this lecture. If you still have got any questions, put it down in the comment section below and I will answer them. Have a very good day. Take care and bye-bye.